We regularly update you about total COVID cases and the number of people in hospitals. But many wonder, what does that mean if I have to go to the hospital? Good evening. I'm Neely Jones.
And I'm Erin Christie. Thank you for joining us. We start with News Channel 8's Maureen Wurtz, who reports one Green Country hospital decided to go an extra step in the name of transparency. Maureen?
Erin, the state of Oklahoma regularly publishes the number of people in the hospitals with COVID, as well as the number of hospital beds, but they don't break it down by individual hospitals. So when people in one area started asking, a hospital in Stillwater decided to do something a little different. In the time of COVID, there are many new obstacles hospitals are facing and new questions they're being asked.
Asking for it, so we're like, let's do it, because that's just, we're part of the community, and we definitely wanted to be transparent, let them know what was going on.
So starting in July, Shyla Eggers with Stillwater Medical Center says the hospital started publishing how many ICU and COVID beds they had available twice a week. And she says it's not about scaring people away from the hospital, but rather letting them know what's going on in their community.
Sometimes we cringe doing it because we don't want to create panic or fear, but if all of a sudden we stop releasing it because it looks scary, then that's not being very transparent.
We know that hospital capacity fluctuates by the minute, really. And is it mostly standard for hospitals not to publish their...
Well, it's never, before COVID, it's never been anything that the public's ever been interested in.
Luana Halstead with the Oklahoma Hospital Association says most hospitals in the state don't release individual bed capacity data, in part because there's a fine line they need to walk, so people don't get discouraged from going to the hospital.
You can't make a decision about going to a hospital based upon, something that's been put out at a certain point in time.
Out at Stillwater Medical Center, the numbers this week aren't so good. ICU beds are almost at capacity, and COVID ICU beds are full. They're now in their surge plan.
Have you guys ever had to get to this type of a plan or something like this in the history of the hospital?
Not that anyone here remembers. So I'm going with no.
Shyla says they have plans in place to increase bed capacity, but there's one thing everyone can do to help keep people out of the hospital.
What we've been talking about all summer long and what we have feared is that, we're not trying to take your rights away from you. We just want you to wear a mask and love your neighbor.
Now, folks at the Stillwater Hospital say that they are capable of creating new COVID beds for incoming patients if they need to, but they're also hopeful that people will just start wearing masks and socially distancing to help them out. Reporting live in downtown Tulsa, Maureen Wurtz, News Channel 8.